start off with Charles McKee, who can start with a brief overview with Charles.
Thank you, May. I appreciate it. And as usual, I appreciate everybody participating today, and apologize. I'm at home and you probably hear my dog barking in the back. I am doing my part to work remotely. Luckily, a lot of the IT infrastructure that we didn't have a few years ago is now obviously a great tool for all of us, whether it's in the media or just regular jobs. And definitely here at the county, we're appreciative of the information technology team that we have, because they're doing a great job. With that, it helps us get out the message. And as I've said before, the message is really critical to get out at this time. And the media is a critical link in that. Getting the public to recognize where and when and what they can do and what the recommendations are has been really successful here in Monterey County. You've done it with all your media platforms, whether it's on air, whether it's in print, blog posts, Twitter, everything else that you can think of has gotten that message out really well. Because as you may have seen in our numbers for Monterey County that went out last night, that we still have growth. It's still a significant issue, and we don't want anyone to be complacent. But we also show that in comparison to some other jurisdictions, we're doing very well as far as adhering to the rules that have been set in place by our health officer, Dr. Moreno, to have the appropriate social distancing, shelter in place if you can, work remotely. All of those things that have been recommended and ordered are having a good effect. However, if you've probably seen some of the data going across from the state and federal level, and maybe here locally, to talk about the peak time for COVID-19 in different areas of the country. And it looks like for California, it looks like to be near the end of April for peak for COVID-19. And with that comes, a lot of significant health concerns. But one of the concerns I have in relation to that, those peak numbers going out there, is this thought that, oh, we hit the peak and then we're done and we're all good. And I'm concerned that people will get complacent. And I want to make sure that we continue to have these briefings so that you can help us get that message out, that complacency can be deadly, and it may not be deadly for you, but it may be deadly for a loved one and or for someone you don't know necessarily, but you can help your fellow human being, your fellow Californian, your fellow American, your fellow Monterey County resident by heeding the warnings and taking it seriously, so that we can flatten the curve. We're doing a good job, but we don't want to let down. This is not the time to let down on all the measures that have been taken. I want to turn it now back to Maya to talk about with some of the particulars, and I am definitely available for any questions in relation to what the county is doing overall.
Thank you, Charles. I see Dr. Moreno has joined us on the line. Dr. Moreno, are you there?
Yes, I'm here, Mia.
Great. I'm wondering if you can give us a brief update.
Certainly, Mia. So good to see everyone on the call today. So as a reminder, we do update our total number of cases and some of the demographics by grouping on our website. We do continue to report new cases almost daily, and we do have, unfortunately, a second death in Monterey County. This was in an adult with underlying medical conditions that put this individual for a greater risk for complications and death. So this is yet another indication that COVID-19 is spreading in our county, and that I know we only have 2 cases, but we are seeing that with the limited number of deaths so far, there's appears to be some consistency with Centers for Disease Control Prevention guidance on who's at greatest risk. So it is still very important that everyone in Monterey County In particular, people who are older adults and have underlying medical conditions do everything they can to follow the health officer order to stay at home and only go out to provide or receive essential services. We also continue to post the number of tests that are being submitted to the Monterey County Health Department. Test results from a variety of laboratories, both in and outside of our county. And that information is also available on our county website. In terms of health officer orders, I'd just like to update folks on the call that, or you may remind you that some of the northern, counties to the north of us in the Bay Area have received orders from their health officers, which are updated orders. So I am reviewing those health officer orders. From my initial assessment from the health officer orders in the Bay Area, they acknowledge that COVID-19 continues to spread, people are dying, and they're still very concerned that the surge that's yet to come could still result in overwhelming the healthcare system and the hospitals and the ICU beds and the ventilators that they have in those counties. So these orders that have been issued are more restrictive than before, and the intent there is to further spread the spread of the virus in their county in order to protect the healthcare system, to allow it to save lives in those counties. So I'm reviewing the health officer order, those health officer orders, with our county council, and we'll be making a decision hopefully soon as to whether or not Monterey County needs to have similar orders in place soon. We continue to conduct containment efforts for isolating individuals who are confirmed with COVID-19 in Monterey County and quarantining those that have been exposed, and working with a variety of businesses and agencies when we identify that they have someone who either associated with that, could be someone who visited or someone who works there, or provide services to their agencies who's been diagnosed, and helping agencies determine how to properly quarantine individuals so that try to slow down the spread of COVID-19. I want to remind people that there's phone numbers that are available for the public and for healthcare providers here at the health department who have questions about COVID-19. Again, that's 755-4521. And I also encourage the public to call 211 for general information about COVID-19. And also, if people want healthcare advice, a reminder that they should call their doctor first. If they are unable to get a hold of their doctor, there are other health advice lines available, such as Montage, affiliated with CHOMP in the peninsula, that has a advice number that people can call and speak to someone free of charge. So encouraging people to take advantage of those opportunities as well. And that's it, Maya. I'll hand it back to you.
Dr. Moreno, would you want to say anything more about getting testing data from commercial laboratories and doctors' offices, if that testing begins there?
As far as receiving test results?
Yes.
Oh, sure. The California Department of Public Health directed commercial labs in California to report positive and negative tests to local health officers. So we are receiving those reports and we are posting them on our website.
All right, thank you. And I'd like to go next to Dr. Gray. If he's on the line, we'll keep on the health theme. Dr. Gray?
Excuse me, I am here. Sorry, I had to unmute. So I'm just going to give a brief update on what's going on at Natividad. I'll start just by giving everyone an overview of our testing. So to date, we have tested 278 patients and we've had 13 positives. Patients have been seen in our emergency medical triage tent adjacent to our emergency department. The hospital capacity overall remains very good. As folks may recall, we have postponed elective procedures, which helps us keep a considerable number of beds in reserve. Our staffing and PPE remain adequate at this time, and we're preparing for contingencies that may come our way in the future.
Right. Thank you, Dr. Gray. And I'd like to go next to Lori Medina, the director of our Social Services Department, for an update.
Thanks, Maya. So in social services, our offices are still serving constituents. We're asking that people who have non-emergent issues try to interact with us via telephone or on our online applications. We do have information posted on our website about how to access those numbers. We are providing emergency services like for Medi-Cal applications, emergency benefit issuances, CalFresh, and in-person responses for our child welfare and adult populations. Social Services is also working as a part of the EOC with a lot of other department representatives to provide services to those that are most impacted and very vulnerable populations. We are also, in terms of working with persons experiencing homelessness, we're coordinating with our coalition of homeless service providers, the EOC, public health, and others for things such as sanitation stations throughout the community where encampments may already exist. We've expanded some of our warming shelter operations to help try to contain any spread for people who have already been accessing our shelter services. We are also working on lease agreements with some hotel motels to have some shelter options available for those who have been homeless, who may have tested positive or are awaiting test results or have very high risk conditions and have had some exposure and need to be able to self-quarantine or self-isolate. In terms of how to reach us, I want to really encourage the public that if people need to apply for aid benefits, we do have an online application that it's a self-help type of application. It's called See for Yourself, and that's www.seeforyourself.com. And we also, that information and interaction is available in Spanish as well. We continue to respond to emergency calls for suspected child abuse and suspected elder abuse. So those community contacts are still available. Of course, one of the things in terms of child abuse, some of our mandated reporters have a lot more limited contact because kids aren't in school and those types of things. So if there is a concern in the community for the child abuse hotline, that number is 1-800-606-6618. And for suspected elder abuse or exploitation, that number is 1-800-510-2020. And I will turn it back to Maya.
Lori, this is Charles, and I'd ask this of everybody in the county staff who are providing info like phone numbers and emails and everything like that. Could you type that into the chat function of the Zoom? That would help, I think, everybody get that information.
Certainly.
And we can do a follow-up email with our partners with those numbers as well. And then I'd like to ask Under Sheriff John Mineau from the Sheriff's Department for an update on what's happening there. Under Sheriff?
Can you hear me now?
There he is. We got him. We got you.
All right, sorry, I got on late. We had something come up that I was trying to deal with, so I just got on the call.
Thank you for joining us.
And help me out, Maya. You just want some some updates here at the sheriff's office?
Yes.
So we are, as most of you know, we've had a lot of things in place at the jail that go all the way back to February 1st, where we started screening anybody that was coming in, any new bookings into the jail. We started doing additional screening upon intake. Where we are now is we're actually, in addition to the screening, any new booking that's coming into the jail is actually being quarantined, just in case somebody is not yet symptomatic, but they are carrying. We're putting them in a housing unit until they've been in the jail for at least 14 days, and provided they don't have any symptoms before we move them into general population. Our jail management team has been working very closely with the courts to cut down on transportations. We're doing a lot more with video court now, and to cut down on having to move people from the jail down to the main Salinas courthouse. They've also been working with the courts on with the courts and with our contract healthcare provider to look at the most vulnerable folks amongst our inmate population, whether that be by age or by their underlying health conditions. And they've been continually screening those and meeting on a daily basis with the courts in reviewing our inmate population. And we have seen some early release orders. Our jail population is down really quite a bit from where it has been over even within the past few months. We're all the way down into the very low 700s right now, which is below our board rated capacity of 825, which gives us quite a bit of flexibility with isolation room, not just for those new bookings upon quarantine, but if we ended up with somebody with symptoms or with a confirmed case, we have enough space now where we could really get those folks isolated. So we're in a pretty good position right now in the jail. As far as on patrol, we are. We're not seeing any large gatherings of folks. We've asked the deputies to take more of an educational approach to the health officer's order, and if we see large gatherings, to engage those folks, let them know, remind them of the health order, try and get people to disperse. We really haven't had any trouble spots on patrol so far, so that's been working great. We've not had any. We've not had any cases that have directly affected our staff. We're trying to stagger some of our coverage to the extent that we can, just in case something comes through. We don't want to end up with everybody infected all at the same time. So from a staffing standpoint, things are going good. From a patrol standpoint, things similarly. And obviously, we just had, I know it broke on the news yesterday, but we did have a coroner's case that was a COVID in coroners yesterday. So we're so far operations are going very smooth, and we are. That's about all we have to report.
Thank you very much, Under Sheriff. And that gives us now an opportunity to open the floor for questions. You can use the hand raise option in Zoom, or you can identify yourself and ask a question. And I don't have any hands raised right now. You can also use the chat to ask a question as well. Any questions out there?
Hi, this is Joe. I don't see how to raise my hand, but I figured I'd just go ahead and ask.
Thank you. Great.
Yeah. Joe Sadowski, Salinas, Californian. I have a question for the undersheriff. So CDCR has said that they are suspending intake of new prisoners. How is that affecting the jail? And what are you all? How are you all dealing with that?
So that on an average week with a typical court calendar, we typically see 6 to 8 people per week that are committed to state prison that move out of our jail and into the state prison. As you probably know, the courts, the calendars have slowed down, so there's going to be fewer. There's not going to be any jury trials in the immediate term. There still could be plea bargains in the immediate term where somebody is committed to state prison. So during normal operations, we would expect to see an additional 6 to 8 people per week in the jail that are staying behind because we can't send them off to state prison. And so really, we're going to have to just see how that number changes. We expect it'll be a downward revision because of the lighter court calendar.
And Under Sheriff, there's an additional question that came in for you on chat. Could you please give more information on the releases that you have done at the jail?
Yeah, so our jail management team has worked with the healthcare team, looking for folks that, based on age or healthcare concerns, would be at a higher risk if they were infected, and then that list has been reviewed with the courts, and ultimately, if the courts see fit to grant people additional credits for time served or to end their sentence and let them out early, then that's happened. And I know that we had an additional 7 that were early released on Monday. I don't have the total number off the top of my head, but all of that's being done in conjunction in the courts. We're not just unilaterally opening the doors and allowing people out. It's got to come from the judge.
All right, thank you. And I have a question for Dr. Moreno. I'm not sure you can answer this question, but did any of the patients or passengers who quarantined at Asilomar test positive for COVID-19? And if so, what happened to them?
Oh, thank you. It's a very good question. So actually, that was considered a federal and state mission. So I don't have update information for that. That would have to go back to either the California Department of Public Health for that question. Or California Office of Emergency Services. So they were running that mission. But it's a good question.
And I have another question for you. Can you clarify the number of tests given to date, and are there plans to increase that number?
Yes, so the number of tests given to date is on our website, and I really hope that people will go to the website and find that information. But our latest up-to-date information shows that we have 860 test results in Monterey County, 860 test results received by our health department. As far as efforts to increase the number of testing, there are efforts in Monterey County and among some of our hospitals to provide additional testing methodologies that are approved by the CDC and California Department of Public Health. So we in our laboratory and some of the laboratories in local hospitals have equipment that could run a test to confirm whether someone has COVID-19 or not. What we are all waiting for is, many of us are waiting for the supplies from the manufacturer of that testing methodology to come to our laboratories. We have not been notified yet whether or not we're going to receive those the materials and the supplies to do that, but we hope that we and our partnering laboratories in the area will get those as soon as possible, and that would help us to do more testing, perform more testing on individuals that have fewer symptoms, not just limited to folks that are being primarily hospitalized or healthcare workers or first responders, but more broadly across the general population.
Dr. Moreno, Joe Sadowski, Salinas, California. A quick follow-up. You said we have not been notified as to when you'll get those test results. Who is not notifying you? Is this a state issue, a private issue, a private business issue, or a federal government issue?
No, this is in the private sector, looking at our vendors that provide a variety of different laboratory supplies to us. So we've made a request to our vendors, and they can't tell us when we're going to get it.
Thank you.
Hi, Bradley.
Adri,
Yes, I'm here.
Adriana, I have a question. Your hand has
Yes.
been raised, so
Yes,
go
yes.
ahead.
So my question is, what other information do we know about the second victim? It was a male, what age, which hospital did he died, any previous condition? I'm sorry if I missed that information before, but can you please explain a little more information about the second person that passed, please?
So Adriana, thank you for the question. So we have, I can't not yet provide more information about people who passed away from COVID-19 in Monterey County. With only 2 deaths, again, it's if I provide any more information, the concern is that their identity might be revealed, and which would be impinge on the privacy of the family. What I can tell you though is there was a time not too long ago where I wasn't able to provide breakdown information by age or region, for example, as we started getting more numbers, we were able to start dividing up and grouping the cases, the confirmed cases. So what I anticipate, what I'll look at soon is, unfortunately, I believe we are going to get more fatalities. As the number of fatalities increase, if we have enough fatalities that, when we get more fatalities, my epidemiologist will make a recommendation as to if and when we might be able to start providing a little more information about the actual fatalities. But at this point, I appreciate your question. At this point, I think it's really important for people to know that we've had 2 adults that have passed away from COVID with underlying medical conditions, which is consistent in part with what the CDC is saying, providing us as risk for complications and death from COVID-19. So what we're seeing here with early on in our pandemic experience seems to be consistent with what's going on in other parts of the country.
and I think Bradley Zeve was trying to ask a question before Adriana.
Yes, I put it out on the chat. I'm just curious, right now the county has tested less than 1/10 of 1% of the local residents. So what is the objective here for the county in terms of number of people to test?
So the objective of testing is to identify, at this point, people who have COVID-19 or are infectious and get those people isolated in hospital. If they're in hospitals, get them isolated. If they're in homes, get them isolated. And if at all possible, we're hoping that if they're homeless individuals, hopefully get them isolated so they don't infect other people. We will continue to do what we can to try to work with with commercial laboratories, with laboratories from hospitals, and other county laboratories who might test some of our county residents to increase the number. And the ability to increase the number of people who are tested depends on a variety of things. It depends on the amount of resources that the hospitals have. How many swabs they have, how many tubes they have to transport the specimens to laboratories. It depends on how much equipment and supplies the various laboratories have to run tests, and staffing, microbiologists and other clinical lab staff to actually perform the test. So there are a lot of resource needs throughout the entire workflow to get test results for people, and there are some limitations right now and some in resources all along that chain of getting people swabbed and test results back.
But at this point, there's no plans to set up some sort of random testing of the community as other communities have done?
So at this point, I'm not recommending that people that do not have symptoms be tested. And that is because right now we're focusing the limited resources we have, we're focusing it on trying to identify people who are at greatest risk of infecting vulnerable populations, people who, if not tested and are hospitalized, could infect, contaminate hospitals and infect or expose, excuse me, expose healthcare workers and first responders. And so we really have to protect our healthcare workers and our first responders. Without healthcare workers, people will go without care and will have more complications and more deaths. And without first responders, we won't have sufficient people enough people to respond to emergencies, to fires, and as necessary to keep the peace and to enforce the health officer orders. So we're really focusing our testing in order to protect our healthcare workers, our healthcare facilities, and our first responders.
All right, and I have a question in chat from KSPW. This is for Lori Medina. Lori, can you please tell us what hotels and motels are open to leases to sheltering homeless during the COVID-19 emergency?
Hi. Yes, thank you for that question. So right now we are currently working with one hotel owner that has 2 locations in the city of Marina. We are finalizing some of those plans, trying to get a lease agreement together. Once we actually are able to finalize that lease, we'd be happy to share the names of those once we're closer to executing that, and it should be in the next few days.
All right, and then I have another question, and then I'll go to the people who have their hands raised. It's regarding the numbers in the daily situation report regarding cases. These are involving people who are ages 0 to 17 and 18 to 49. These are 2 age groups, and are they considered one? There are 27 cases for those 2 groups. So I think for you, Dr. Moreno, this is a question for you as to why those age groups are lumped together.
Certainly, Maya. So I can't speak for the daily report for reports on cases outside of the health department's webpage. I can only speak to our webpage, and our webpage is updated every day. We have 2 age groups, 0 to 17 and 18 to 49, but the total number of individuals are grouped together to span the age group 0 to 49. So we went ahead and separated those 2 age groups, knowing that when we have adequate numbers of individuals in both the 0 to 17 and the 18 to 49, at that point we'll be able to divide up the number of individuals into each of those age groups. But until we have enough individuals in that age group, we're going to continue to group those 2 age groups, the number of individuals into those 2 age groups. Same thing goes for our region of residence. We don't have enough cases in North County and in South County to be able to separate that out without risking disclosure of who those individuals might be. So unfortunately, we will have more cases, and when we do, and we have enough cases in both North County and South County, we'll go ahead and break that one up as well.
All right, thank you. And now Sara Rubin from the Weekly has had her hand up. And so what's your question, Sara?
I have one question for Dr. Moreno while you're talking. Can you hear me?
Yes, I hear
Yes.
you.
Okay. You talked a little bit about how you're reviewing with County Council the possibility of updating Monterey County's order to reflect some of our neighboring counties to the north and be more stringent. Are there particular circumstances that might cause you to implement a stricter order, a particular number of confirmed cases or deaths, or what are some of the factors that could tip that scale for you?
Yes, very good. Yeah, there are multiple factors. I think one of the main factors is knowing that what we've seen in Santa Clara County and the other neighboring counties. So what they have expressed is that there has been some benefit in those counties from the shelter-in-place order that was placed a couple weeks ago, and so there has been some benefit. However, based on their projections, there's still a real threat from COVID-19 of overwhelming their healthcare system. And if they don't take additional actions, then the surge, when it occurs, could overwhelm the healthcare system, and not just overwhelm the healthcare system, but overwhelm the healthcare system for several weeks. So that's their main concern. And so they at this point, they felt it was necessary to be more restrictive. I believe that we're going to have a similar experience here in Monterey County, and it won't be. We probably will not surge the same time that Santa Clara has their surge, because we've lagged behind Santa Clara by a few weeks. But I expect we're going to have a very similar experience here in Monterey County. So from what we've learned from out of guidance from the Centers of Disease Control and Prevention and National Institutes of Health is that the earlier that social distancing strategies are implemented, the greater impact it has down the road in reducing the spread and reducing the amount of surge placed on the healthcare system and how long that surge lasts. So that's probably the main consideration. The other considerations will be what our actual experience here is. So as we get more cases and unfortunately more deaths, our epidemiologists, I'm hoping pretty soon will be able to actually start providing for us the data in a graph format that shows whether or not we have reached exponential growth of COVID-19 in our county. And when we reach exponential growth of COVID-19, that would also be considered as to whether and when I update my health officer order.
And Sara, did you also have a question for the undersheriff?
I did. Chief Mineau, I was wondering if you could expand a little bit for us on enforcement through education as you described. And I wonder if there is any mechanism for tracking who you've contacted, and then is there a certain number of times that they get a warning in educational outreach before there is a citation issued? And just, you know, some of the context is we have heard from readers again and again that they see large groups of people congregating close together, socializing, recreating, all kinds of things, and they express this to us. And I remind them we are not an enforcement agency, but I wonder if you're getting those kinds of tips and if there is, you know, some kind of next step that's been taken or may be taken.
Sure. So if people see large gatherings or large groups of people, they can certainly call the comm center and make a report, and we'll respond and see if there's and obviously our goal is to make sure everybody understands the health officer's order, to get them to disperse and to get them to leave. The second part is, yes, there's teeth in the health officer's order. It is a misdemeanor to violate that section. We're really hoping to not end up in a position where we have to actually make a physical arrest and take people off of the streets and put them in the jail, because really the short answer is that's the kind of offense that's going to be subject to an immediate release via the county's own recognizance release order. So it would be taking somebody off the street, it would be taking them to the jail and going through all of the process to get them booked. And it would be the long story short is it's an immediate release. So we'd be taking folks off the street, taking deputies off the street, and it would be for a book and release. And then really the folks would still have to appear in court and would have to potentially have to answer to that charge. But it's our goal is to do it as much as we can through education, break up large groups, make sure people understand. Ultimately, if they refuse, our deputies can take the enforcement action that's appropriate, and certainly that could end with a physical arrest. Really we don't want to end up having to go down that road. People have been good. I think people want to comply, and as long as they're willing to work with us, we're going to work with them and just break up the groups and try and send them home.
Thank you, Undersheriff. I have a question from the Herald for Dr. Moreno. What is the information on the fatality in terms of age, gender, location, travel, and whether it was contracted from family members or the general population? If this is a HIPAA issue, can you explain exactly how this is a violation?
So thank you for the question. As I stated before, I can't release any more information without running the risk that someone from the general public could identify who these people are, and which would violate the privacy of the family members.
All right. And then I think this next question is for you also. Does the county have a goal on a percentage of residents to test, such as 10%, 25%? Right now, the county has tested at 1/10 of 1%.
No, that's not part of our strategy.
Okay. Next question is from KSBW. What is the county's recommendation on wearing masks? Should everyone be wearing masks in public to prevent transmission? And if so, do they need to be N95 or should those be saved or donated to healthcare workers?
Certainly. So this is Ed Moreno. So there is no recommendation at this point for the general public to wear masks. There are recommendations. I'm sorry. There are practices for healthcare providers to wear masks in certain situations when they're working in a healthcare setting. But again, there's no recommendation right now for the general public to wear masks. There are still recommendations that if you're sick, stay home, and if you have to cough or sneeze, cough into a tissue and throw it away and wash your hands, or cough into your elbows.
All right, and here's another question for you. So the smallest number of cases are in the age groups most likely to be infected, but asymptomatic or experiencing mild symptoms. What does that tell you or us about the actual spread of coronavirus in the community?
Actually, because we have, the numbers are too small to come to any conclusions, but I think we have enough cases and a couple of deaths now in Monterey County to indicate that COVID is spreading. It's throughout the county. Everyone should assume that it's in their community, in their neighborhoods, and the best thing people can do is to follow the health officer order and stay at home unless you're providing or receiving essential services.
All right, and I know that you have to leave, Dr. Moreno, but I did have one question about donating masks. And it could be for Dr. Moreno or Gary Gray. Should people be donating masks for healthcare workers, either in hospitals or public health?
I think Gary should respond, but just quickly, we are the Office of Emergency Services, I believe, is working on ways to establish mechanisms for individuals or organizations to donate masks to the county to be put into use by healthcare workers.
I think from the hospital, I think all the hospitals would certainly welcome donations of PPE, N95s if folks have them at home. I believe it certainly is reasonable and appropriate to donate them to the local hospitals. And other PPE as well. The nitrile gloves that people might have around that they use to change the oil in the car, plastic gowns that people might use. I think all the hospitals have an interest in increasing their stockpile.
All right, thank you. I have one last question, and I think Dr. Moreno has to step off the call, but Dr. Gray, perhaps you might be able to answer this. This is about the FDA approval of antibody tests yesterday. After the Surge and Apex, when can we expect to have that test here? And do you have any idea what it would be like or look like?
Actually, I'm not equipped to comment specifically on the antibody test. I think all facilities are looking at other testing platforms. I think the challenges that everyone's going to experience, at least in the short run, is that a lot of the allocations of testing platforms are being allocated to those regions of the country that have the most dire need. So we do anticipate a flow of other testing modalities coming into the county. I just cannot predict when that time might be.
Thank you, Dr. Gray. And then Joe from the Californian has his hand raised.
Yeah, thank you. I don't know if Dr. Moreno is still on the call, but also I want to ask this question to Dr. Gray. We've been talking about, there's the real fear here is that there's a surge and it overwhelms the system. So Dr. Moreno, if you're still on the call, great. But if not, I still ask Dr. Gray, okay, that surge happens, the system gets overwhelmed. What happens next?
Well, I think each individual hospital is likely working on their own surge capacity. We've continued to work on a surge capacity and meet daily to evaluate our bed availability and the resources around both equipment and people to support those beds. So I think, for the foreseeable future, given, kind of the current incidence of infection that we're seeing, I do not see a short-term issue with regard to bed availability. I know that the county, in a broader sense, it continues to look also at broader planning. I think alternative care locations that were mentioned for the homeless and all that will all help us preserve our bed capacities in our individual institutions. So I believe that everyone's being responsive and planning appropriately.
Thank you, Dr. Gray.
Dr.
Do you have
Gray,
a
if I may
follow-up,
just
Joe?
follow up.
Sure.
But my question was, what if that surge happens and the system gets overwhelmed? What do you do next?
I think in that particular case, I think you start looking at expanding alternative care sites. As you know, the governor has created a healthcare pool of workers. I think you would have to begin to tap into outside resources to provide additional clinical care capacity.
Thank you, Dr. Gray.
Yes,
And
thank you, Dr. Gray.
I have a question for Lori Medina. Has social services seen a significant uptick of applications for aid?
Thank you for the question. Yes, we have seen an uptick in our applications for aid. I can't really speak right now to the numbers or the significance of the numbers. We do expect for those application requests to continue to rise right now as people start to experience layoffs and those types of events. Also, Medi-Cal applications are increasing, as well as our CalFresh or food stamp applications.
Thank you, Lori. Are there any? I have no more questions in chat, and I have no hands raised.
Actually,
are there more?
Maya, I have a question
Sure. Yes,
for Dr.
please.
Gray. I was just wondering, do you know how many ventilators Natividad currently has available?
Well, the actual number depends upon how many are currently being used, but we have a considerable number, somewhere between 70 and 80, depending upon the numbers that are presently in use for patient care.
Thank you. And one other question for Natividad. Have you all been experiencing any type of difficulties obtaining PPE or any other type of essential equipment? And if so, what could you describe them, or have you heard of other hospitals you're working with who have?
Certainly would be reluctant to speak for our other hospitals, but just focusing on Natividad, I think our PPE supply is reasonably adequate. If we were to project it out for a period of 30 days or so, I think is certainly adequate. I think we continue to look for sources to augment our supply to ensure that it remains sufficient. As of today and for the short future, we do not anticipate any shortages that would impact patient care.
Thank you.
Are there any other questions for any of our county staff?
I guess one last question, Maya, if no one else
Sure.
has any questions.
Sure, go ahead.
This would be for the undersheriff. What else is the sheriff's office looking at in terms of any type of early releases or other ways to reduce the risk of the spread of COVID-19?
Well, the good news is with the health officer's order in place, there is less activity. So we've definitely seen a downward bump in bookings, which is part of what's driving our overall population down. So with the natural effect from the health order, there's fewer people coming in, which is good. And as people serve out their sentences, we grant all of the available statutory credits that people can get for accelerated release. We're going to continue to work with the courts, and as we sit right now, we're in a better position than we've been in years with our jail population, because again, the capacity is 825. We're down in the very low 700s, which gives us a lot of room and a lot of flexibility to move people in and out of different housing units for both for quarantine and for an isolation if we end up with an infected person in the case. We're screening all the inmates. We're screening all of our employees with temp checks as they come in. Just to, again, we want to do everything we can to keep it out of there. But if we do end up with a case, as we stand today, we're in really good shape to be able to isolate and quarantine as necessary to not have a bigger problem if it ends up inside the jail.
Thank you, Under Sheriff. Are there any other questions from our friends on the call? And so I see Charles McKee is still on the call. Do you want a last word, Charles?
Excuse me. So the follow-on, I would say, is that the information that we're providing is kind of the critical link in solving COVID-19 for us locally as well as across the nation. So I just appreciate everybody getting the message and understanding the message and heeding the warnings of our healthcare professionals. So thank you to everybody.
Right, and thank you all for joining us on our media briefing today. Our next briefing will be on Friday, April 3rd. See you then.